All right, very good. So welcome, and this is medical terminology. Tonight we are going to get through chapter 4, and I'm going to share my screen, and this is the PowerPoint. Chapter 4 is body structure. Okay, so I'm going to put this up as a slideshow, and we'll get through this as quickly as we can. If we have questions, we'll deal with them at the end. Okay, so save them till the end. And let's get started. So body structure. So the body is based on levels of organization from the smallest to the largest. So the smallest thing in the body is the cell. And the cell has a cell membrane and cytoplasm and the nucleus, which is the brain of the cell. Cells work together to form tissue. Tissues form organs. Organs form systems. And systems all work together to create an organism, which is the human body. Okay. When we talk about body planes, in other words, dividing the body into different sections, mid-sagittal, which is the median plane. In other words, if you slice the person down the middle. Coronal is the frontal plane, and transverse is if you slice them in half at the waist, the horizontal plane. Body cavities, we look at dorsal. Just think about a shark with a dorsal fin. That's the posterior. So you have the main body cavities. The dorsal body cavity is your main central nervous system. It's the cranial cavity, which contains the brain, and the spinal cavity, which contains the spine. And then the ventral is the anterior body cavity, and that's divided into the thoracic section, which is where the lungs and the heart are, the abdominal section, all your abdominal organs, the stomach, the spleen, the gallbladder, etc., and then the pelvic section, reproductive organs, intestines, etc. So, and we'll do the body cavity exercises, all the exercises at the end, but just make sure you know these terms: dorsal, ventral, the dorsal cavities and the ventral cavities. You'll probably see those on a quiz. And then we look at quads or quadrants, and meaning 4. So the abdominopelvic cavity is divided into 4 quadrants. So just imagine a line just down the center, right at the belly button, the umbilicus. You have a horizontal line and a vertical line, and you have your right and left upper quads and your right and left lower quads. And the reason we do that is because they give us reference points. In other words, if I say that the patient has bowel sounds that are absent at the right lower quad, I know pretty much what part of the intestine we're talking about. So they're used as reference points for locating pain, locating incisional sites, locating tumors. You know, so if I document that it's, you know, the tumor is in the left upper quad, you know exactly where to look, right? And this is the way they are abbreviated, right? Right upper quad, left upper quad, right lower quad, left lower quad. Then the abdominopelvic region is also broken down into 9 regions if we want to get even more specific. So if you look at the picture, we've got the right and left hypochondriac regions. We have the epigastric region, right and left lumbar, umbilical, which is right dead in the center, the right and left inguinal or iliac, and then the hypogastric. So if you notice, epigastric is kind of like above the stomach, hypogastric is below the stomach, the umbilical region's in the middle, right? And these 9 reference points give us even more specificity when we're talking about the location of pain or the location of a surgical procedure, an incision or a tumor, that type of thing. They're used for descriptive purposes. So these are the exercises. Again, at the end, we'll do those. When we look at the combining forms, you all remember that from the first chapter, right? The different structures for the cell, the nucleus, and the tissue. So start working on that now before the lecture's over. And then the exercises for the combining forms of the words for position and direction, and also for the regions of the body. And then we have combining forms for color. And then there's some combining forms that are descriptive: dry, extremity, internal organs, disease, etc. And then here are some exercises that we will go through later at the end. And building medical words. This PowerPoint is mostly exercises. All right, let's get into diseases and conditions. So a disease, that means something is wrong. If we say, it's a morbid condition, the word morbid means that it can harm you. If it's something that can cause mortality, that means it can kill you. So a pathological or morbid condition, disease has a group of signs and symptoms and very specific clinical findings. And diseases mess with homeostasis, right? Which is that state of balance or equilibrium inside the body. Like your body temperature is at a pretty specific level, 98.6 or somewhere thereabouts. Your fluid volume status, so how hydrated you are. Your acid-base balance, the pH of your blood, right? And then your electrolytes, like your sodium and magnesium, and potassium, et cetera. So diseases disrupt all of these things. What is the difference between a sign and a symptom? So a sign is something that's an objective indicator, something like you can see it, a rash, swelling, a lump. A symptom is something that's more subjective. If the patient says, I feel dizzy, I feel nauseous, right? Those are symptoms, okay? So diseases are caused by lots of different types of things. Diseases can be metabolic, like diabetes. They can be infectious, tons of infectious diseases like the flu and COVID. They can be congenital, so you're born with them, like a cleft palate. Hereditary, like hemophilia, also sickle cell anemia. Neoplastic, which means cancer. They can be environmental, like something that happens, trauma, burns, car accidents, etc. Here are some more vocabulary words that you need to know. So we'll go through these. An adhesion. Basically, an adhesion, it's the definition is an abnormal fiber span binding tissues that are normally separated. When we talk about an adhesion, scar tissue, basically scar tissue. Tissue that forms that has exceptional amounts of band binding in it. So it's not the same as other normal tissue, keloids or scar tissue. Inflammation. Inflammation actually serves a purpose. And so it's your defense against injury. So when, if you bang your knee typically will kind of swell up at the area. It can get red, kind of hot, painful, right? That inflammation is actually your body's defense system, your immune response, sending a message for cytokines to come and say, hey, there's a problem here. Bring the white blood cells, fix this, right? So inflammation serves a purpose. And then the word febrile means that you're running a temperature, a fever, you're feverish. And I already talked about morbid. Morbid means it's something pathological. It can hurt you. Sepsis. I'm sure that everybody has at least heard at some point, oh my gosh, he was septic or he went septic. The word sepsis refers to an infection that is generalized throughout the body, right? Suppurative, like supportive. What else? And here we go. So they go through, we don't use suppurative pertaining to pus, we use purulent. So I'm actually going to say, don't worry about that word. The word purulent, and I will add that in here. I'll type it in when I get it in a different format. If we say the patient had purulent exudate coming from the wound on the left lower extremity, that is the medical term for pus. Something purulent is thick, right? It's viscous, tenacious, colorful, doesn't smell good, right? So now we'll talk about some procedures. So we talked about words like, graphy, right? Like graph and gram. So electrocardiography, electro meaning electrical, cardio, the heart, graphy, we're recording something. It's the electrical activity of the heart. And so we put electrodes on the body in specific places, and those electrodes send impulses to the device that records what actually the heart activity is. Sometimes they can do a 24-hour Holter monitor, which can be a 3-lead ECG. And by the way, ECG and EKG mean the same thing. They both mean electrocardiography. The origin of the word is German. And so electrocardiography, it was a K, not a C. So either way is correct, ECG or EKG. So you have a 3-lead, a 5-lead, and a 12-lead, right? Then here are some clinical terms, things that we do with patients. We auscultate. That means we're listening to something, the heart, the lungs, bowels, usually with a stethoscope, but sometimes without, because we're assessing quality of sounds and maybe presence or absence of sounds, like with bowel sounds, to determine what kind of, clinical state the patient's in. Inspection, we're looking. People that are going to be going into the nursing program, you will find yourself walking through ShopRite and looking at people and going, oh, he better get to a doctor. What's going on with him? But, you can't help it. General observation of the person as a whole person, right? But you'll notice things like, oh, the lower extremities are edematous, right? Do they look well nourished, or do they look, malnourished? What kind of state of health are they in? Palpation is a gentle feeling, right? You're putting the hands on a part of the body or structure of the body to feel it, to see if there's a texture, if it's symmetrical, if it hurts the patient, if it's tender to the touch. And then percussion, just like with drums, is tapping. Usually when we're talking about lung sounds, percussion is used, and also with abdominal assessment. You're tapping a body structure either with your hand or your fingers to assess whether it's a dull or a hollow sound. So like, for example, if there's fluid where there shouldn't be fluid in the lungs, you're going to hear a dull sound when you percuss it. Okay. Spirometry. So spirometry itself is a function test of the lungs, right? It measures the volume and the flow of air into and out of the lungs. You have heard of an incentive spirometer. That's the little gadget that we give patients always post-operatively, and it encourages them to take a nice deep breath in. And the incentive is that there's like a little ball inside this plastic device that they hold. And when they take a deep breath into the tube, the little ball rises, and there are markings with numbers. And the incentive is, oh, you got to 1,000. Can you get that up to 1,200? So it encourages deep breathing for the patient to prevent post-op complications like pneumonia. It helps with the assessment of lung disorders. So there's spirometry testing that is used that has to do with inhaling and exhaling, right? Spirometry can improve lung function because it increases the total volume of air that's moving in and out of the lungs. And again, here you go, ordered for patients who have had surgeries. Almost any operation, a surgical procedure, would necessitate the use of an incentive spirometer post-operatively to prevent post-op complications. We have this word, this is a fun word, anastomosis. So an anastomosis is surgically piecing together either two ducts or two vessels, usually referring to the bowel, right? To let them be connected. So allowing things to flow from one of them to the other. Okay, that's an anastomosis. When it comes to the digestive tract, if someone, say, has a temporary ostomy, when we reverse the ostomy, we have to go in and do an anastomosis so that we reconnect those two parts of the bowel together and get rid of the stoma, right? So it's just surgically connecting two ducts or vessels or part of the bowel. Biopsy, everyone's probably heard this word before. We're taking a sample of something, tissue, blood, body fluid, to send it to the lab to see, to evaluate, to figure out what's going on. Is there a new lesion there? And we want to find out if it's malignant or benign. In other words, is it cancerous or not? So biopsy gives us a definitive diagnostic tool where we can actually get a little piece of that something and send it to the lab to identify what it is. So here's an exercise, and this is something, again, we'll do at the end, but I'm just going to read it. So Mr. L's saphenous vein is excised and used to bypass an occlusion in one of his heart vessels. That's a CABG, coronary artery bypass graft. Surgery that joins two vessels to allow the free flow of blood between them is called, and you guys know, it's an anastomosis. Mrs. W is told that deep breathing post-op is essential to avoid lung complications. The doctor instructs her to use an incentive spirometer. This device helps prevent fluid buildup in the lungs. Okay, some more procedures. Whenever you see SCOPY at the end, like in this case, we have endoscopy, we're going in to an organ or into a cavity with a scope, an endoscope inside. And it's usually got a camera on it, and we're looking at things. We also can use an endoscope to guide us for surgical procedures that are done minimally invasively, like a laparoscopic cholecystectomy, which is where we would remove a gallbladder without making an actual incision. We can just make these small puncture holes, and one of them is where the scope goes in, and the others, the tools can go in, and we can remove the gallbladder that way. There are other procedures that are done with the scope, but the endoscope can be used just to look at something, right? Maybe we just want to do a bronchoscopy, and that would be looking at the bronchus, looking in the lungs, right? Radiography. Radiography means X-ray. So we're using this electromagnetic beam to go through the body. It produces images, pictures, right? Great for looking at bones, also good for lungs, like in this case. Sometimes we can give the patient radio-opaque IV dye for certain radiographs of different types of tissues that we want to see more clearly. We use contrast dye for many different diagnostic procedures. Ultrasound. Anybody who's ever been pregnant has probably had an ultrasound. Ultrasound, ultra meaning high frequency sound waves that get emitted by this little thing called a transducer, or it can even be a probe if we have to put it internally, and it produces an image of something of the body inside the body on a computer screen. We use ultrasounds for during pregnancy to look at the fetus and the placenta, etc. We use an ultrasound of the heart that's called an echocardiogram to look at the chambers inside the heart and those kinds of things. So ultrasound doesn't use X-ray frequencies. It's just using sound. Sound waves emitted, the transducer. Here, there's a picture where the transducer just kind of goes back and forth with this really cold gel, and it actually sends the sound transmission through the gel and then into the body and produces the picture on the screen. So let's see, sound waves from a transducer reflected from internal structure comes back as echoes. You don't really need to know all the specificity here, but it produces a picture for us so we can see what's going on inside. Now this, a little more state-of-the-art, positron emission tomography, also known as a PET scan. So PET scans are used very frequently in two cases. One is with cancer, looking for areas that are most illuminated, which can indicate, metastasis of cancer. And also we're looking sometimes at the metabolic activity of the brain. So we use a radioactive chemical, we put it in the body and through an IV, and then that tracer, that chemical, wherever it accumulates the most rapidly, that's where we know that there is something of high density or a problem. So like I said, PET scans most commonly used with cancer patients. So PET scans, positively charged particles, those are the positrons. They get emitted into that body region. And then there's this camera called a gamma camera that produces an image. Like I said, looking at things like tumors, right? So when we see this increased metabolic activity or this high, the high area of illumination, usually a tumor. When there's decreased illumination, it could be things like Alzheimer's disease or Parkinson's, then usually we're looking at the brain. Then we have MRI, magnetic resonance imaging. And that's just a big, giant magnet. And it uses radio waves and magnets to produce these teeny tiny, super specific cross-sectional images of whatever you want to look at. The brain, the most common. This is the definitive diagnostic tool for soft tissue. So, if you hurt your back, they'll do an X-ray first, but an X-ray is not going to show soft tissue damage. It will show fractures in bones and those types of things. An MRI with a good technician can slice the pictures so thin that you can just get detail that you can't even imagine. So this is really, MRI is one of the definitive diagnostic tools that we use. Right beneath MRI, we've got CT, computed tomography. They also call it a CAT scan. And so it uses X-rays, right? But the X-rays are kind of beamed in. The patient goes into this coffin-like apparatus, and the beams kind of rotate all the way around the patient. this gives us some really good views of the body. The views get sent to the computer and the computer gives us images. Okay. So those are diagnostics. Here are some more exercises. I'm going to skip through that and look at that. Chapter 4 is done, and done.